blue suit, and yellow ties. So if we wore orange ties, then it would have been. Kathy Bevins is coming. David's going to be late. Tom, David's going to be. Okay. Why don't we just start? Why don't we call this budget hearing to order? And first we have our health department. And we have our auditor, Mike Walther, to present. Mike?
The proposed fiscal year FY 2020 budget for the Department of Health totals approximately $82.1 million, an increase of roughly $6.4 million or 8.4% from the FY 2019 budget. The general fund portion decreases by approximately $1 million or 4.4%, primarily due to the elimination of the community nursing chronic disease program and a reduction in funding for the animal services program, partially offset by the second half of the January 2019 3% COLA. The special fund portion of the budget increases by approximately $7.4 million or 14.4% from the FY 2019 budget. This increase is primarily attributable to additional funding in the Medical Assistance Transportation Grant and new substance use initiatives and state opioid response grants. Based on our analysis, we have identified one potential budget reduction totaling approximately $42,000. In FY 2017, funding appropriated for supplemental security guard coverage at the Baldwin Animal Shelter totaled $177,632. Budgeted funding for supplemental guard coverage has been reduced in each year since, and the proposed FY 2020 budget eliminates this funding. Unless the department has a plan to rely on other security personnel to fill in on days when the sole employee is not scheduled to work, it would appear that security guard staffing is not necessary at this site in order for the site to operate. Accordingly, this potential reduction would delete one security guard position and would fully eliminate security guard staffing at the county's animal shelter in Baldwin. Typically, our office would not identify the potential elimination of a filled position. However, when preparing our analysis, we noted 4 vacant security guard positions in other county agencies, according to information provided by the Office of Budget and Finance. The reduction is explained beginning at page 5 of the analysis. In addition, this analysis details 3 significant policy changes, including the opioid epidemic, animal services, and the aforementioned elimination of the community nursing program, which begin on page 6, and other public health concerns beginning on page 16. At this time, I would like to turn it over for discussion.
Dr. Branch, always good to see you. Thank you, as always, for your great work in the Department of Health. And any presentation or response for the audited staff?
I do. Good afternoon, Mr. Chairman and council members. I count it an honor and a privilege to serve as the Director of Health and Human Services. It's given me the opportunity to make a difference in the lives of the people that we serve, and I would say the people and their pets who live, work, and play in this great county. As it relates to our health, social services, housing, and human relations. And I would like to take a moment, if I could, to just introduce 3 of my deputies here. Can you please stand and introduce yourselves?
Benjamin Delawayson, Deputy Health Officer.
Henry, Deputy Finance Administration.
Good afternoon, I'm Mark Mansell, Deputy Director of Department of Social Services.
All right, then, and I'm not going to take too much time, but I'm going to have my other staff just please stand. I won't introduce them at this particular time. Just stand on up. I appreciate them because they do so much great work. I'm going to give them a hand clap myself. Thank you so much. Let me just begin with a brief overview of the budget for the Department of Health. For fiscal year 2020, health budget is $82.1 million, 2/3 of which is grant funded in 2 main categories: our general health grants and our behavioral health grants. For the general health grants, it's increasing by approximately $3.9 million in fiscal year 2020. And this is mainly due to a projected increase in the funding for our Medicaid transportation program. The Medicaid transportation program transport recipients to and from doctor's appointments. Our behavioral health grants are increasing by $3.6 million. The main driver of this increase is anticipated state funding for additional substance use initiatives and programs. Now, our fiscal year 2020 general fund budget is decreasing by almost $1.1 million or 4.4%. This decrease is primarily attributed to the elimination of our community nursing chronic disease program. Now, the billable component of this program provided skilled nursing visits to patients being discharged from the hospitals. Over the course of the past several years, hospitals have initiated their own skilled nursing services, resulting in a significant decrease in referrals and revenue to the Department of Health. Therefore, we discontinued the service, which will now be provided by the hospitals. Now, consequently, some of our non-billable services will be reduced as they were provided by the same staff who provide the skilled nursing services. And the department will continue to seek other grants and private resources to continue our chronic disease programs. The elimination of this program created a reduction in 14 positions in the department. All, and I say all, of the incumbents will be placed in vacant positions by July 1st. Thus, no one will lose their jobs. So from our authorized positions, we will begin fiscal year 2020 with 625 authorized county positions. This represents an increase in 26 positions from fiscal year 2019 due to some grants, specifically the MCHIP grant, the hepatitis C grant, and also behavioral health grants. There's a proposed cut. Regarding the potential budget reduction of $41,860 to the security presence at the Baldwin facility and Animal Services, we respectfully disagree with that cut. In times like these, with mass shootings, violence, and easy access to weapons, I don't believe that we should be reducing a security presence at any of our locations. In fiscal year 2019, we've had numerous security incidents at the Animal Services. One, people trying to steal animals, belligerent individuals, and a lot of fanatical individuals. On a daily basis, the Department of Health and Human Services encounters disgruntled clients. We take custody of people's children, we take guardianship of vulnerable adults, we impound their pets, and we deny financial benefits when they don't meet the requirements. Due to the serious nature of our work, we are truly at times the heavy hand of the government, as we are a soft target for violence. This responsibility should never be taken lightly. A daily security presence at Health and Human Services, specifically Animal Services, is of the utmost importance from a safety perspective. I'd like to talk a little bit about the opioid epidemic. I'd like to thank Councilman Crandall, who recently gave me a book authored by Sam Quinones, Dreamland, which chronicles firsthand stories of numerous families ripped apart by the opioid epidemic. The author writes, "This epidemic involves more users and far more deaths than the crack plague of the 90s or the heroin plague of the 70s. Quinones highlights stories of kids dying from this epidemic in the Rust Belt of Ohio and the Bible Belt of Tennessee. Unfortunately, he could have easily included similar stories and interviews with families right here in Baltimore County who are suffering the same plight. Dreamland highlights the fact that for the thousands who die each year across the country due to this epidemic, thousands more continue to suffer from the addiction. Ladies and gentlemen, we are truly in a fight. We are truly in a battle, and we're truly in a war for the lives of our loved ones. And there are three essential tools that we need to combat this epidemic. One is the residential beds. I am extraordinarily happy to say that in approximately 2 months, we will open our first residential treatment facility here in Baltimore County. The department has worked with county purchasing and county property management to remodel the Richards building located on the grounds of Rosewood property. and we're soliciting a vendor to operate a residential treatment program. The second tool is recovery housing. Recovery housing is a critical component of the continuum of substance use treatment. It is clinically managed, low-intensity residential treatment services which teaches life skills such as education, job readiness, and relationship building that will help prepare an individual for successful reentry into the community. Baltimore County officially has no recovery housing. Baltimore County has no recovery housing. Therefore, we refer all of our residents needing this service to neighborhood jurisdictions. Medication-assisted treatment is a proven pharmacological treatment for opioid use disorders. It's effective at reducing the use of opioids and helping people to lead normal, productive lives. Medication-assisted therapy includes things like methadone, buprenorphine, and Vivitrol. And it's the evidence-based practice recommended by the CDC. There are several MAT providers in Baltimore County, and the department has recently started a program in conjunction with the county's detention center to provide MAT, medication-assisted treatment, to inmates in need. As you know about our outreach plan, REACH, it stands for Recovery, Education, Assessment, Collaboration, and a Helpline. It has laid the foundation for all of our efforts in this fight. In addition to the REACH plan, the county executive's budget includes a new opioid coordinator position. This position will primarily provide interagency coordination across all agencies. And that would include Health and Human Services, Fire, EMS, Police, Emergency Management, Corrections, State Attorneys, and Sheriff, Public Schools, Economic, and Workforce Development. In addition to the addition of the $3.7 million in potential state and federal funding, the department has just completed an application for a CDC Overdose Data to Action grant. If we receive this grant, it will provide us with a database that would allow us to collect real-time information, just-in-time information from all of our response partners, including police, EMS, detention center, and crisis. It also includes additional education to provide us for proper prescribing, ongoing evaluation of data, and funding for our community organizations to assist victims of overdoses and their families. Animal services. The auditors have asked specific questions regarding animal services, which included changes in services, the Cuddle Shuttle, the Southwest Park spay-neuter site, the Animal Abuse Unit in Animal Services, the Animal Services Advisory Commission report, and the Sound Wall. As you're aware, our Animal Services program is undergoing changes that will support our overall efforts to do the following. We're going to increase transparency throughout the organization. We're enhancing community collaboration. We're going to broaden the opportunity for volunteer involvement and expand services, including the fostering of dogs and enhancement of the adoption practices. The reduction in the program funding into animal services is primarily due to the reallocation and deletions of positions. Our new organizational structure will incorporate and build on the recommendations cited in the 2018 Animal Services Advisory Report. Some of those recommendations are already in place, including retraining of the staff regarding owner-requested euthanasia. Operation hours are now 7 days a week for adoptions, surrendering, and volunteering. New standard operating procedures for volunteer duties are in process, and complaints from the public are being addressed in a much more timely manner. The Cuddle Shuttle continues to be a great resource to bring animals to potential adopters, and the department has successfully adopted 132 animals via the Cuddle Shuttle since its inception. In reference to the Sound Wall, it is currently in the bidding stage. And the Southwest Area Park was not producing the spay and neuter numbers that we had originally anticipated. Therefore, we made a business decision to close that facility. The Animal Abuse Unit now meets weekly with Animal Services staff to share and discuss cases. And I want to remind the council of the mission of Health Department, which is healthy people and pets living, working, and playing in Baltimore County. We have some other public health concerns that you guys have heard of. One of them being is tobacco, vaping, and juuling. A combination of educational outreach efforts and aggressive enforcement actions have proven successful in decreasing the rate of licensed tobacco retailers that sell tobacco products to our minors in Baltimore County. Our Baltimore County sign-on numbers reveal that we've had an unprecedented reduction in tobacco sales to minors. We've gone from 54.7% in fiscal year 2015 to 0% in fiscal year 2019. While this is certainly great news, we must address the growing threats of increased use of the electronic smoking devices by minors. Juuling is becoming a major public health issue. The department will continue to award grants to schools to supplement their tobacco prevention curriculum. But we need to change the laws to give our department the ability to enforce the sales of smoking electronic devices to minors. Then we will be just as successful with reducing sales of these electronic smoking devices to minors as we are with tobacco sales to minors. Vulnerable populations and barriers. At the heart of all what we do, our goal is to remove barriers that prevent Baltimore County residents from leading healthy, safe, and productive lives. These barriers appear at any point throughout the life continuum. That might be barriers that prevent babies from being born healthy. Obstacles that result in the need for shelter housing for homeless individuals, and addressing challenges in helping seniors to be able to remain independent in their homes as long as possible. We address these barriers in a myriad of ways. We have 7 health centers located around the county, which provide a safety net to address public health needs. These include immunization, family planning, dentistry, sexually transmitted infection screening, and treatment. The department provides nurses and case managers who help navigate a sometimes difficult healthcare system. We provide language line and bilingual staff whenever possible to address the language barrier. We're even beginning new classes next month where we'll be providing command Spanish classes for our staff. Our MCHIP program addresses the barrier of lack of insurance by assisting individuals to obtain health insurance at our 4 sites and for the Baltimore County Detention Center. That's very, very important because, as you know, in the Baltimore County Detention Center, when people are discharged from or they are released from the detention center, they have a much, much, much higher rate of having an opioid overdose death. And one of the reasons why that is because if they don't have medical assistance when they leave, then they're not in their programs. Once you are arrested and you get into jail, your medical assistance automatically goes away. And so when you're coming out, we got to get it to you as soon as possible because you can't get to a treatment program until you have it. So we actually make sure that our inmates have their insurance upon release, which is extraordinarily important so that they don't go out and overdose. We have a partnership program which assists clients in navigating the healthcare services when they're not eligible for traditional insurance. The department also offers 14 school-based wellness centers that allow students to be seen at school for routine medical care. This enables parents to not miss time from work and to avoid the transportation barriers. Our WIC program has extended our hours to open 2 Saturdays per month to meet the needs of the residents. And the department is also able to address the barrier of transportation by providing vendor services or vouchers to medically necessary appointments. The last thing I just wanted to mention, and you've heard about this, and that is the measles. A recent media report has shown the issue of measles as a public health threat, and that this threat has reemerged. Although considered eradicated before 2000, areas of this country have seen a resurgence of this highly contagious disease. Currently, Maryland has 4 cases of the measles. None of those cases are Baltimore County residents, but we have had potential exposures in our county. So let me give you an idea of how contagious measles is. Let's just say that there's a staff person who came into this room to clean this room up approximately 2 hours before we got in. If that person had measles and was contagious, when we came in here, if any of us were not immune, we could still catch the measles from that person. That is how contagious measles is. We do know that if you put a person with measles in a room with people who are not immune to it, 90% of the people in that room will come down with measles. It lingers in the air and it's always around. Highly, highly, highly contagious. And there are several aftermath and complications of that which could potentially be fatal. So that's why it's so important that we immunize everyone against measles. In the past few weeks, the Department of Health has held 2 measles vaccination clinics. Between these 2 clinics, we were able to vaccinate approximately 1,000 individuals. The department continues to monitor new and emerging health concerns, being our ongoing collaboration with community providers and hospitals, the State Department of Health, and the CDC. We respond quickly, efficiently, typically using our incident command structure in any immediate response indicated. We train and we drill for this every year. You guys know that we do this when we have our Super Saturday, and we are actually in 7 different locations simultaneously. That is actually a drill for us to do that. Well, when we had to do our measles immunization, we were able to stand up shop. And I have to say this, other jurisdictions have had their mass clinics. And when you go to other jurisdictions, you will see that they will have a wait time up to 2 hours. When Baltimore County had its MMR clinic, I can tell you that there was no wait time. And the through time from when you entered the door to the time that you were exiting the door was 7 to 11 minutes, depending on how quickly you could fill out your own paperwork. That is something that we do extraordinarily well, and I would just like to take this opportunity to acknowledge specifically Della Leister, my deputy director. Give her a hand clap. Because Della is the person who really drives the staff to be able to complete a task in such an efficient and effective manner. And I will say to you that I am proud and glad to be here because of what those staff are capable of doing. So I want to thank you for the opportunity to discuss the programs and services of the Department of Health and Human Services and budget matters. I'm happy to answer any questions that you may have, and I would be remiss if I didn't thank the council, the county executive, the administration, and all my staff for their hard work and dedication.
Great. Thank you. Thank you, Dr. Branch, and thank you for going through a lot of the auditor questions and really the things on my mind opioids and animal services and the measles outbreak, and I think you really covered a lot in a short period of time. So I do appreciate that. So I'd like to open up to council members. Any Councilman Catch?
Thank you, Mr. Chairman. I thank you for your presentation and the attendance of your cabinet.
Oh, my staff, my deputy.
Your cabinet.
Okay, you said cabinet.
Hey, first of all, I want to commend you and the county executive for the opioid rehab center at Rosewood. I mean, I think that's long overdue. Do we have an alcohol rehab facility, don't we?
No.
We did long, so I guess we've gotten rid of it. I thought we had one. So what about alcohol?
What about alcohol?
What about a residential facility for people who?
What happens at this point now, when we are dealing with all types of issues. To tell you the truth, when it comes to an alcohol bed, we're not having as much issues and difficulties as it is when it comes to the opioid beds. There has been a resurgence of the opioid issues, and so therefore there are no beds for that. One of the other issues that we have with opioids is when someone comes and says, I need help, they need help then, and I can't wait. That's why I've got to get these beds open. And the reason why is because if you wait an hour or two, as simple as that, that person needs another hit, and they're going to leave you.
Yeah, they're going to have quite a task in front of them, and I just want to accommodate you for this, what you're doing with the community health, et cetera. I think all that is very good. Just one question about the animal shelter. How many positions do we have today for whether guards or whatever they are?
We have one security guard that's there at this particular time.
Okay.
And then we were using some of the contractor services for the weekend.
Gotcha. Now, so is the security guard there just during the hours that the shelter is open, or I mean, obviously someone can't work 24 hours a
Right,
day?
no, when the shelter's open.
Okay.
Yeah.
Okay. And so there are no problems after that when it's locked down.
Well, we don't have necessary, quote, problems, but we did have an incident. We just had an incident that you may have seen on television. We had a woman who brought a rabid raccoon to the animal shelter after hours. It just so happened, and she actually took the animal out of her car and left it there. It was after hours. We happened to have a staff member who was there, went out, saw that the raccoon was actually kind of acting funny, knew what to do. We tested the raccoon for rabies. Raccoon had rabies. At this particular time, we've got to find that woman, because if you get licked, scratched, or bitten by an animal who has rabies, then you can succumb to rabies. And rabies, once you are symptomatic, is 100% fatal. So we saw, and she just wrapped it in a coat and put it in her car, in the inside of her car. And then she had actually put it out on the ground in front of animal services. So with all that, we didn't know what was happening, so we had to get the police involved. You may have seen me on the news begging this woman to kind of show herself, but I can say at this particular time that we found her. So we can actually now deal with that particular issue, because once she becomes symptomatic, rabies is a 100% fatal. So stuff does happen at the end, but we don't need the security guard for that kind of stuff. But things do happen at all hours at animal services.
Thank you very much.
Councilwoman Bevins?
Thank you, Mr. Chair. I have a comment and then two questions. My comment being thank you for all that you do and your entire staff. You're so very responsive to my office, and I appreciate that. No matter how small the question or issue may be, up to larger questions and issues, you treat them all the same. So I truly appreciate that, and so does my constituency. So I wanted to ask about the measles. Now, I'm old, so I don't know if things have changed. Maybe this is a question for the school system, but I think it would be for you. When my kids went to school and my grandkids started going to school, you could not get into school without your vaccination. So how are children and our children, I guess, getting into our school system without being vaccinated?
What happens is there are two reasons why a child may not be vaccinated. If they have a medical contraindication, or it could be potentially for a religious reason. I'm happy to say that in the state of Maryland and in Baltimore County, we have an immunization rate that is extraordinarily high for the country, which is over 97%. So that's actually very, very good. For the folks who are a little bit more seasoned, and that's for anybody who was born before 1957. So I would say everybody except Kathy. You guys are going to be
That's very
immune,
sweet of you.
right? So you guys will be immune, that kind of stuff. And what happens is that for the other folks, you're going to need to get your immunization. And I will tell
I still got the
anybody.
big scar on
Yeah,
the
you
arm,
got-
that big old scar.
Oh, yeah, me too.
If you haven't been immunized, I would say go see your doctor because you can become immunized. It's very, very simple, right? If you don't know, take the shot.
Okay, so am I confused about, I saw it on the news that, so it wasn't people in Julian's district that had the measles, they were people in your district that contracted that contracted the measles? Is that what it was?
So what
They
happens?
live in Baltimore County,
So,
people that
so
had
let
the-
me just, I'm going to say this in the best way I can say this. So the individuals who contracted the measles visited our county
Okay.
by going to different locations, so that when their jurisdiction investigates that, they can call us, because then we have to investigate any potential exposures within our jurisdiction.
Okay,
That's what
thank
comes
you,
down
I
to.
do got it.
So what happens is the fact that when they were exposed in our jurisdiction, because they were public places, now we've got to put it out on the news to say if anybody was there between this time and that time,
Okay,
please come forward, because measles is very contagious.
thank you for explaining that.
And I will say to you that the original people got it from out of our state.
Right, I did see
Right.
that. My second question is, going back to the correction center and inmates that are released that get insurance. Is that for all inmates or just inmates that have addiction problems that want to seek recovery or continuing recovery? And I guess, let me back up, that already have started recovery while they were incarcerated and then want to continue it or
Right.
maintain it once they're released?
Any inmate that is qualified for medical assistance.
Okay, all right.
Because you could have high blood pressure, you could have diabetes, you could have any other disease that we're trying to keep you following up on those particular diseases. So it's anybody who qualifies for medical assistance.
Okay, thank you.
Councilman Crandall?
Thank you, Mr. Chairman. Dr. Branch, I do want to thank you for, when you give someone a book, sometimes they don't read it. In fact, often they don't read it, but you obviously did, and I'm not going to go too much into the opioid crisis that we're facing, because you and I have had many conversations, sort of impromptu conversations that last a long time and are very educational for me. You happen to mention juuling, dabbing is another thing. So the chemicals being put into, I guess for lack of a better term, because I don't really know how these things work, is put into a pipe. I think the next sort of wave are very dangerous levels of THC in some of these products. So my question to you is, are you seeing more of that type of, we get, I think it's called dabbing, where young people are taking the high concentrations of THC and smoking it through a device. It's odorless, smokeless, apparently, and it seems to be gaining more popularity if you talk to some of our educators.
Right. So when we talk to our the youth who are in schools and things like that, we are definitely seeing it. As you remember me talking last year, I think it was last year, when we were talking about people smoking marijuana and things like that, and it was laced with rat poison. Remember that? Well, that was very important, because they were coming in with a lot of bleeding issues. So yes, with all of these different devices, they start off with a little bit of tobacco or some type of nicotine type thing, and then more stuff is being put in those things. And so that's why we're trying to get the devices out of the hands of children.
Okay, well, and, okay, thank you for that. And I want to get into a couple of things, the sort of nitty-gritty of more budget questions, but I do want to make the comment that it's in education every budget cycle. Now, this is the fifth budget that I've had the honor of working on, and it's just amazing how widespread your agency is. Maybe one of the more widespread agencies in all of Baltimore County, just in terms of the number of issues and the different types of issues and the services that you all provide. So you and your staff should be commended for that work. Now, we provide treatment in the county correctional facility. Is that treatment paid for and administered out of your budget or out of corrections? And I'm trying to think of some of the contracts that have come before us, and I can't recall whose budget that comes out
So
of.
specifically for the medication-assisted treatment, we actually put a grant in for that, and we got a grant for that. And between that SAMHSA grant, which is a federal grant, and additional monies for the medications from the state, we're able to do that particular program. So that program is not being, quote, paid for by the county.
Okay, and your agency is administering.
Okay, so
that.
we actually overseeing it,
Okay.
but the contractor, which is Prime Care, who gives the medical treatment to the inmates,
I got it.
they're actually doing it. We're overseeing that particular
And administering the
program.
grant.
Right.
Okay, very good. The new opioid strategy coordinator's office. Is there a cost attached to that, and how is that office envisioned to be structured?
So at this particular time, that person would be under the Department of Health and Human Services, and then we would have obviously a position. So that is going to be a position, not necessarily an office. And then any of their needs, their supportive needs, will be supported by my department.
Okay, very good. Thank you, sir.
Okay.
Other Councilman Patoka?
Thank you, Dr. Branch. I have a couple of questions. The first relates to the opioid treatment center on the Rosewood campus. Is the operator for that Gaudenzia?
At this particular time, that has not been finalized, but that's going to be finalized very soon, if I'm not mistaken.
Okay. For me, and for my district, it's really important to have a really highly qualified operator, simply because of where it's located. It's located next to where Stevenson University will be. There's a K-8 school right next door called the Torah Institute. And so some members of the community have reached out to me and just asked that we be particularly sensitive to, and I know that the perception of treatment for someone going through opioid addiction is different than the reality. I've toured Gaudenzia, for example, and they've shared with me the steps that they go through in terms of the patient going through crisis first, then detox, then 28-day program, and then job readiness. And so, but rarely are they outside of the facility. So I think it's more perception than reality. So, but I just, if you could make sure that the operator is someone who's highly qualified and sensitive to the surrounding communities. The other question I have relates to the measles. And you said you engage in Super Saturday. What is Super Saturday?
Okay. Super Saturday is when we do the flu vaccinations, and we do flu vaccinations in all 7 jurisdictions. Councilmatic districts. And so what we do is we have at the same time, we put it out there for the public to come in to get their immunization, the flu shot. And we do that because we remember back to the H1N1, when everybody was trying to get their flu vaccines. So we're at this point now, we always try to practice, rehearse, so that when something really comes through, we're able to do that very, very quickly.
Are you incorporating the measles vaccine into that regiment on Saturdays?
So that's exactly what we did for these past 2 measles. So when we had gone through those measles clinics, we did the same exact way that we would do a flu shot. The only difference is because of the community that we were dealing with, we had to have a separate men's and women's side. It complicated the situation somewhat, but we were able to still be very efficient and effective getting everyone through despite the fact of having a men's and women's side.
Okay, thank you. And I'm going to request something that's also complicated as well, that will also deal with the men's and women's side, and to consider having a Super Sunday. And the reason I say that is because in my district there's a large Orthodox Jewish community, and I know that they're not going to participate in a Super Saturday in any way. And I think it's particularly important since these incidents of the measles in Baltimore, I know they're not in Baltimore County, but are close, the residents live close to Baltimore County. The clinic, I think it's a clinic or medical office, where it was identified was in the 2nd District. And so maybe if you're able to consider working with one of the faith-based institutions in the 2nd District for the Orthodox Jewish community, it might help. I know that the rabbis would be interested in messaging out the importance of measles shot, along with getting how you just shared with us how contagious it is from the medical side, from the clinical side. I think that would be really important and something to consider.
So when we did the measles, we worked with the Rabbinical Council. So I'll speak to Rabbinical Council regarding what they would like for the flu shots. And as long as the community is receptive of the flu shots, like they are now of the measles, we can always provide something for that community.
Okay, thank you. And then the final question deals with homelessness. So along two of the commercial areas in my district, we have homeless men and women, and quite frankly, I don't know what to do, how to address that, and I'm looking for guidance on that.
Okay.
They're
So-
living in commercial districts.
So I always say we can help, but I would say that when the Department of Planning comes before you, you can ask them that question.
It's in
Because
planning?
the Homeless Services is under Department of Planning at this particular time. So
I wonder if we're unique in the nation for that, having...
He'll be here.
Okay.
He'll be here today.
That's
Planning will
really
be here
interesting.
today.
Wow.
Yep.
You learn something new every day.
Any other questions or comments from the council for Dr. Branch? Councilman Jones.
Yes, Dr. Branch, I just wanted to thank you and all your staff for the wonderful job that you do each and every day to keep us safe here in Baltimore County.
you're welcome.
Anyone else? Yeah, I did want to echo Councilman Jones' comments as well. I mean, I think the Department of Health is often the unsung heroes because you truly do deal with people that are in really sometimes desperate situations, and a lot of times you're like the last resort. So we do greatly appreciate the work that you do, Dr. Branch, and your team does, and we really do appreciate every day the block and tackle work that helps our citizens go, and I'm a big fan of what you do. So thank you all so much. All righty,
Okay.
I think we're done for Department of Health. Thank you again. Does the council need to take a 1-minute break before we do OIT? Okay, 1-minute break, and then we'll be right back, okay? 1 minute.